And we're starting our recording. And in about 30 seconds, Jenny, you can start.
Okay, just tell me, say go.
Okay, Jenny, go ahead.
Okay. Good morning, Oregon Realtors, and welcome to our webinar this morning discussing the new association health plan. My name is Jenny Pakula. I'm the CEO for the Oregon Realtors, and we're fortunate today to have two of our insurance folks that are the admins and the contacts for the large group health plan that the Oregon Realtors recently got approved by the state of Oregon. I want to introduce you to our two speakers, and then I'm going to turn it over to them to give you a little history of how we got here, what it means, how do you determine whether you're eligible, and to answer any questions you have on the health plan. Because since we launched, and this is new to us, so we have changed a lot of the marketing materials and the way the message is delivered to make it clear, but today is an hour for you to determine whether you're eligible, what it means for you, how much you can save in premium, all the great benefits, because this is an incredible offering that the association is bringing to you. And I'm going to let the experts tell you the how and whys of it. So this morning, we have David Johnson from Johnson Benefit Group. Dave has worked in the insurance industry since 1991. His employee benefits background includes extensive involvement in the design and implementation of insured and self-insured plans for a broad spectrum of public and private organizations on the West Coast, with an emphasis on association health plans for the last 10 years. Joining Dave is Sally Marsh with Providence Health Plans. Sally has worked in group health insurance for over 27 years. She is responsible for selling and implementing commercial small and large group business, as well as self-funded and group association health plans for Providence Health Plan. Please submit your questions via chat, and Dave and Sally will answer them throughout the call. And if we can't get to everything during this hour, we will do your best to have Dave or Sally, Dave, give you a call to follow up with you or your company on any questions you may have. I am really, really excited to have these two share with you all of the benefits of this health plan. And without further ado, Dave, take it away.
Thanks, Jenny, and thank you all for attending the Oregon Realtors Association Health Plan webinar. As Jenny stated, my name is Dave Johnson with Johnson Benefit Group, and again, we have Sally Marsh from Providence, who will also be speaking today. I'm going to kind of jump right in. Feel free to use that chat box to send in questions. Sally's got the control over what the slides look like. One of the things that we've heard is that there is some confusion as to what an AHP is, and hopefully we can clear that up today. So on this slide, you can see, simply put, an association health plan is a type of group plan that allows people to come together to leverage, or companies to come together to leverage their purchasing power to access group health insurance under a large group contract. And that's really important because that gives us a fair amount of flexibility within plan designs and stuff like that to kind of curtail to the group needs. Association health plans, as part of a large group contract, usually offer some savings associated with pooling like entities together for ease of administration. So what we do is we take a look at how many people we have and try to bring our administration costs down over the course of the standing up a new health plan. While owners and, let's see, I live in Washington State, but I am a licensed realtor. We're starting to get some questions.
If you can keep going through your presentation, and I don't want you to have to feel like you got to stop in the middle. We'll keep track of those.
Okay, perfect.
I mean, if you see them, go ahead. But
one of the confusing points is, who is actually eligible, and we're going to get into that in a second. But under an association health plan, while owners and contracted individuals are not counted as common law employees, they can be offered coverage as part of the group dynamics of the company applying within the AHP. So that means that we're going to have some certain regulations surrounding what an eligible group is. Sally? So, and we'll get into the eligibility here in a moment. I just want to give a little bit of background quickly on, how did we get here? We've got a fair amount, my company has a fair amount of experience with association health plans. We manage 3 of the largest association health plans in the state. A couple of years ago, Jenny and I were talking, and there was some legislation that kind of piqued our interest in, could we offer an association health plan to the realtors? And it started out as an RFP process. And if you're familiar with what an RFP is a initial process where we send out a request for proposal and see if there's any interest from the provider community. So about 2 years ago, I crafted this RFP and sent it out to all the carriers in the marketplace. After some discussion with most of them, Providence raised their hand and said, "Hey, you know what, Dave, you and your company have quite a bit of experience and background in association health plans. We're willing to partner with you." And because of the way that we crafted the RFP, we were able to get a carrier, Providence, to jump on board and start the process with the DFR. Now, the DFR is kind of the controlling body of the state when you're filing for a association health plan. And so over the course of about 2 years, and I have probably had over 100 meetings in that time discussing, plan designs and getting the plan filed with the state, getting their approval. We actually didn't think that we were going to get approval this year. Some of the stuff that the DFR was giving back to us was said, due to COVID, we're not going to approve any health plans. And then I'm over in Central Oregon, driving around, and my phone starts blowing up, and Sally's saying, we got approved. And this was in September of this year. So once we got approved from the DFR and literally hundreds of meetings and hundreds of hours of work on Providence's part, on the OAR's part, and our part, we finally got approval.
So why was it such a struggle, Dave? I mean, why was there so much pushback on this? And why would the state drag its feet for association health plans when healthcare for everyone is such a big initiative?
Well, and Sally, you can chime in here as well. We had COVID. We also had, at the time, there were 14 different health plans that were submitted to the DFR. We actually had the first one in, and funny enough, we were the first one out of those 14 approved during that timeline. But they actually put the brakes on it after our initial submission and said, by the way, we've got 14 different health plans. We need to go to the Department of Labor and get a ruling from them on how we should proceed. And so basically each week I was sending an email to my contact at the DFR saying, do you need any more information? Where are you at with the DOL? What are you doing with this, that, and the other? There was, obviously multiple layers of information that they were in need of or had from us. And we felt very confident, with Providence's regulatory department, that we had filed it correctly. It was in place, that there shouldn't be any waiting period. So once they got past that, that was late 2019, after almost a year of going back and forth with them. They had kind of put the kibosh on. And then in February, we submitted some more information that they asked for. We got the, information that it was good information that we submitted to them. And then COVID hit. And so in March, we thought we were going to be approved in March. Well, obviously COVID threw a wrench into that works. And they put a stop to everything because they had taken their focus from association health plans into COVID, and all their resources were going to COVID regulations and background. So
I guess more specifically, and Sally, please jump in on this. I want it on the federal level, because as you are probably aware, on the federal level, the National Association has really tried hard to get legislation passed, and I know President Trump supported it, for associations to be able to bring health plans to their independent to their members, including independent contractors, specifically realtors. And that got shut down by several states, including Oregon, where there was a lawsuit filed by the attorney generals. And if you could give a really brief layman's explanation on why the feds, why the courts, they're so opposed. They say we're skirting Obamacare. What would give it easy to understand? Because I think that a lot of our members are going to a little bit like, well, why can't the association offer a health plan? I don't understand. So could we talk about that?
Sure, I'd be happy to actually address some of that. And I think you kind of hit the nail on the head. The federal government has been very supportive of changes to association health plans. And really, there's access issues. And so each state has control through their DFR, the Department of Regulation. And each state kind of interprets what the federal government is saying is allowable, and then can adopt their own standards and guidelines. A lot of the states did say that they didn't think that the loosening of all the association health plan regulations were something that they wanted to jump on board with. While they were allowed to be more flexible, they weren't sure that they wanted to gain that flexibility. And part of that, I think, is due to association health plans competing in the small group space. Small employer health insurance is very heavily regulated. SHOP is a misnomer in the state of Oregon. SHOP was Cover Oregon, and it did not come to be. But we do still have like tax credits for small employers within the state of Oregon if you're a SHOP approved carrier. Association health plans do compete in that small employer health insurance space, but with the offering of a large group association health plan contract. So they want to make sure that they're protecting that small employer market, as well as they're looking at the individual space. A lot of folks, especially contractors, are in the individual market. And they did have some questions about that. You know, how will this compete with the individual market? That was one of the things that we were very specific on, that we would not be competing against the individual market with this association health plan, because they are set up and designed to be group contracts for smaller group and medium-sized group entities within an association health plan contract.
Which is why, and correct me if I'm wrong, when you and Dave start talking about eligibility criteria, that is why we, Oregon Realtors, do not offer the health plan to our individual members, because that would circumvent exactly what the courts have prevented. So you and Dave, and I'd like our members to really understand this, is that you both work so hard to craft a application to the state to work, I hate to use the term workaround, but to work around the barriers that have been imposed at the federal level. And many states are saying, well, we're not allowing this. And including Oregon, I believe our attorney general was one of 12 that filed a lawsuit to prevent association health plans at the state level.
Yeah, to really work with the guidance and the rules laid forth for association health plans. We worked in coordination with the DFR. The individual market is not something that an association health plan should be competing against. Individuals within the individual market are eligible for some things like subsidies and different types of programs. It is age rated, but this association health plan offers affordable coverage to smaller groups. But in the small group market, the state of Oregon has adopted the federal small employer counting methodology, which is for small employers, you have to have at least one common law employee. And that common law employee can't be an owner or the spouse of an owner. And it can't be considered a seasonal, temporary, leased employee. They have to be a common law employee or it can be a child. It can be an uncle or brother, as long as they're not an owner in the entity. But you have to have one common law employee to be considered a small employer business in the state of Oregon. And that's by federal definition that we've adopted those guidelines since the ACA rolled out.
Okay, so apparently the federal sorry, apparently the federal history is not that. I think it's really important to give a brief background on why, because so much of the pushback has been, well, why can't we have individual coverage? Well, they need to understand why you can't and why the eligibility criteria is the way it is. So let's launch right in to, if they have questions about history, they can ask later, but let's launch right into the eligibility, what it means. And
Well, I wanted to say, I wanted to state one other thing, Jenny, and I think this is important. Had we constructed it as an individual policy or open to everybody and individual policies and whatnot, we would have never got it approved. And two, we would have never had a partner like Providence step up to the plate and provide the backing, provide the health insurance to our members. We wouldn't be having this conversation today had we not constructed it under the federal guidelines of what a group is.
gotcha.
And the only reason that they decided to move forward with it, and to be honest, this is the first plan, and correct me if I'm wrong on the date here, this is the first new association health plan with zero membership in it, not a takeover, to be stood up by Providence in almost 20 years.
Yes, that's correct. We do have other associations that we've had in place for over 25 years, like the Multnomah Bar Association. We have the Oregon Association of Nurseries, Salem Contractors Exchange, all upstanding association health plans. But this is the first brand new stand-up association health plan Providence has taken on in many years. And we did that under consideration of the type of industry, the very strict RISA approved guidelines around this association. And in partnership with Johnson Benefit Group, because they have such a vast knowledge in association health plan coverage. And we knew that if any agency could help stand up a new association, it would be David, Johnson Benefit Group.
Great. Okay, and I see some of the questions that are coming in are exactly why we're having this webinar, to talk about eligibility, sole proprietors, husband and wife teams. So yeah, I mean, you guys can see the questions. Every one of these questions coming in are exactly what we're talking about today. So can we get right into, rather than getting into billing, let's talk about eligibility. And
eligibility, as Sally stated earlier, is set by the state and federal government as to what a group plan is. So under those strict guidelines, and the state determines these, we require 2 enrolled people. One of them has to be a common law employee that's not the owner or the spouse of an owner. There's nothing we can do to get around that because of the way that we filed with the state and the approval with that filing and the agreement from Providence. We had to have it as a group plan, could not be an individual plan. There's no 100% family owned, not just an owner or a spouse of an owner, but again, one common law employee is required.
So if a husband and wife, if they have a child that works for the company, they'd qualify.
Absolutely.
Yes, if they work enough hours. And I think this has actually been an issue with folks having a hard time understanding this because they are a business. And I think the easiest way to explain this, and I've explained this in small group for about 25 years, is it's not a question of whether or not you're a business, because a husband and wife obviously can be a business and is a business. It's the employer-employee relationship. It's, are you a qualified group under the federal guidelines of defining what a small group is? And the federal guidelines say that you have to have at least one common law employee, and that cannot be an owner or the spouse of an owner. And it actually couldn't even be like 2 brothers that owned it, or just two people that went together and joined a business because they're both owners. The one reason they mentioned spouses is because before the ACA, like a mom and pop shop would put one of them in as a W-2 employee and say, well, we have an employee that's on the books as W-2. And that was kind of a workaround. But the ACA actually changed that with the federal definition and said it can't be an owner, the spouse of an owner, and it has to be what's considered a common law employee. So it's not that they're not a business, it's that they have to be considered a group by definition of small employer group health insurance guidelines.
So if the husband wife has a child under 18 covered, do they have to be on the payroll?
They have to be.
Yeah,
they have to be a common law. They have to be a common law employee working enough hours to be eligible for the plan on their own right. And they have to be not only eligible, but enrolled to be considered that common law employee to meet the small group definition guidelines.
And here's one other thing about that common law employee. If you have a common law employee, the business has to pay 50% of the premium toward the cost of the lowest cost plan. I think that's important because we have the other situation with the 1099 realtors where they're paying 100% of the premium. The establishment of the group has to have that common law employee where there's some sort of contribution toward their cost, which is a minimum of 50%.
Right. So it gotcha. So again, this question keeps coming up. And so as an individual sole proprietor on my own, am I eligible?
No.
Right. Okay. And that's by virtue of the approval, the regulations, it's large group health. It's group.
Right.
It's not for individual. And that's where the confusion comes. They think, well, why can't you, Oregon Realtors, offer the plan to all of us individually?
Yeah, because it wouldn't qualify. We would be in violation of the ERISA filing that we have with the state of Oregon if we went out and wrote a whole bunch of just individuals. We have to have that linchpin of a group with that common law employee. And I guess there's no gray area. It's very, very black and white. And in order for us to continue to sell this plan and help as many people as possible, we have to stay within the guidelines that we've submitted to the state.
And I see lots of, this is unfair. Trust me, your national association, we are lobbying for this all the time. We are shut down. They are shut down to offer association health plans to individuals. As for now maybe it will change, but it's not that you can't get individual coverage, but it does not fall within the group health plan. And that's what's so cool about this opportunity for companies to offer to their agents. And I don't know what to say. How can they get around? Let's say it's a 3-person shop. You have to have, and they don't have any W-2 employees. You have to have one W-2 employee. Even if there's 3 people in a company, say husband, wife, and somebody else that works for the company, they still need to have a W-2 employee to qualify for the group plan. Is that correct?
Correct.
Okay.
Yeah.
Okay.
So I think we've covered the first couple of bullets. The dual choice, once we establish that the group wants to move forward, we've actually got quite a few plans. We're going to get into the plan designs and a little bit more information about Providence here in a few minutes. But under the guidelines of how we've set this up and what plans can be offered, if you have 2 to 9 employees and or 1099 agents, you can have 2 plans out of the 20. I think we have 29 plans now. If you have 10 plus, and employees, I know that 1099s and employees are obviously different, and they're not considered employees, but we're going to use employees as a generic term, for the most part. You can have up to 3 plans if you have 10 or more enrolled. Okay. On the eligibility, on when somebody becomes eligible for a plan, usually first of the month. This is after we put a plan in place. First of the month following date of hire, or 30 or 60 days first of the month after that waiting period. We don't allow employee-only contracts. It must be offered to dependents as well, but we don't require any participation of those dependents. We don't require participation within that particular grouping. Here's where everybody seems to be a little bit confused, is this last bullet. And I've heard from more than one agency that there's no way I'm going to get 75% participation in my group. 75% participation is a little bit of a misnomer, in that the caveat is, if I have group insurance elsewhere, and that's Medicare, spouse insurance, TRICARE, or Indian Health Services, those don't go against our 75%. So let's take the example of a 100 life group, and 25% of that group, or 25 people, have group insurance elsewhere. Now we're looking at 75% of the eligibles to enroll out of that 75. So actually it becomes 56 at the end of the day that need to enroll in order to make the group plan viable. Final rates are always determined by final enrollment. So if your enrollment differs from the census that you provided, then the rates would change, obviously. So one of the things that people have asked is, can I have the rates? I think this is a good time to address that. The rates are based on the group demographics of itself, and that's name, date of birth, gender, and zip code. Because we have zip code factors, we have age factors, we have all this stuff. We plug that into a census, and then we can produce the rates. There is a little bit of work to be done on your side as a participating group in order to get us that information so that we can provide a quote. So yeah, here's a good question. We have 40 agents and 20 of them have group insurance elsewhere. Then it would be based off of the 20 that are left that we have to have 75% in order to participate in the plan. And I think that would end up being 15. So, you know, it's the math is fairly straightforward. Take off the ones that have valid waivers, and then your 75% is based on the remaining number.
So if a realtor enrolls, can their spouse enroll that's not a realtor? Can they be part of the plan?
Sure.
So anyone in the family, if a realtor enrolls in the company plan, they can bring on anyone, any eligible family members, spouse, kids, et
Yes,
cetera.
absolutely. Yeah, this
Okay.
is a group plan for families and individuals.
Okay. Okay.
Domestic partners as well. I think that's a really important distinction.
Right.
That's a really
Yeah,
nice
domestic
feature.
partners as well.
Is domestic partners, both same and opposite gender, are allowed coverage on this plan. And a common question we get is, what about stepchildren? And honestly, we often get asked questions about grandchildren. Grandchildren, if they're in your care and you're providing their support, they are as well eligible for the plan.
Yeah. So good question here. And I know they're coming in fast and furious. And if we can't get to all of them, I will make sure I get these questions to Sally and Dave. And we do have an FAQ on our website, and we can add some of these to our FAQ. So what happens if a group enrolls and agents leave companies and go elsewhere and they fall below the minimum? Are you going to all of a sudden cancel that group?
No. Once your plan is reviewed and in place, it's not reviewed again until upon renewal.
Yeah.
So if you drop below the 75% participation, and even at renewal, it's actually pretty hard not to meet that 75% participation, and it really confuses a lot of people.
Yes.
Dave explained it really well. But another way of thinking of it is those people who have coverage to other group coverage or TRICARE or Indian Health, those count toward that 75% participation requirement. So we count them as if they were covered by Providence. And so
Okay.
of that 100, 75 people have to have some form of coverage, whether it's Providence's coverage through the association health plan, or they've waived to other valid coverage.
Okay. Okay. That makes sense. So
that might be another way to think of it.
Yes, that's really helpful. So as long as they have coverage elsewhere, whether it's to their spouse or even if they have individual coverage and they want to stay with their individual coverage, would that count towards the 75%?
Coverage to individual does not count toward the 75%.
Okay.
But coverage to the Oregon Health Plan does. Because if they're at because the Oregon Health Plan has very strict requirements around your income level. And if they've qualified for the Oregon Health Plan, our goal is not to remove their eligibility for the Oregon Health Plan. So the Oregon Health Plan does count as other coverage.
Got it. So for companies that are renewing, and let's say they have to renew this month, which most companies do, what if they just renewed? Are they out of luck for the next year?
No,
what can you do to help them?
We have all year long enrollment, so they can come on any month with any month.
Can they cancel if they already renewed with another carrier, small group, individual, but now they're going to bring a plan for their company and their agents and their W-2, and they've renewed? They can cancel that without penalty, and if everything worked with the Providence plan for them?
Yeah, health plans issue a 12-month contract. We're required to issue you a 12-month contract, but we have groups at Providence term mid-year all the time. Even though we've issued your availability to have that contract for 12 months, you're able to cancel your contract anytime with us on a direct basis. So they can come on throughout the year.
And, and one of the things, Jenny, is, you know, when we were putting this plan together, you run into a lot of associations that have one renewal date. And that really inhibits your ability to write business or bring new people on. You know, who knows, not everybody, I mean, we started this at the end of September. So we're a couple months into this, and I completely understand the frustration of people who said, well, I've got to sign up for my individual coverage by December 15th. We have had this, we've got this set up like the other two association plans that we run, that you can write business January 1, February 1, March 1, April, June, July, August. Throughout the year, we can bring new groups on and they will get a 12-month contract. That was critical to the, in our belief, as we have seen in our other plans, to make sure that this plan can grow organically throughout the year.
Okay,
yes,
so
each group will get their own group number and we'll have a 12-month availability to that plan and rate that they selected at the time they became effective with Providence.
yeah, here's a good question, and I've seen it come up a couple of times. I'm a realtor in Oregon, but I'm a resident in Washington. Will I be eligible to participate in this plan? Yes, because?
Sure.
Yes, it's a great question.
There's one caveat that you have to have. You have to be a member in good standing with the Oregon Association of Realtors, right?
Yep.
So as long as you have a contract or a membership with Oregon Realtors, and I need to remember Oregon Realtors instead of the other ones, still getting used to that, then we can absolutely have you on the plan.
Good. So that would include, we have a number of affiliate members, appraisers, title companies. I mean, same criteria. It's got to be a company. It's not individual cover for appraisers, but if they work in a firm that is a member of the Oregon Realtors, they would be eligible to participate.
Well, no, because here's the deal that we have. The way we filed it, it's for realtors and realtors only and their companies. Now, we will at some point in time look to expand to affiliates, but at this time, when you do a filing, you have to understand that it has to be very clean and very straightforward. And some of the other association plans got into hot water when they were doing their submissions, and Sally can attest to this because they were part of it, that they were trying to bring in auto dealers into a wood products trust, or oil companies into a construction trust, or whatever the case may be. We had to be very careful when we filed this with the state that we wanted to have a single silo and direct, a very good definition of who was going to be covered. The affiliates, that may be something that we can do down the line next year or the year after. But the affiliates are not available.
And that's a really good point, because while some of our affiliates are industry related, appraisers, titles, some of them are not. They'd like to do business with our members and they join the organization. So, okay, I got it on that. So here's a question. I think I know the answer, but a W-2 employee does not have to be a realtor. They work for a company that is part of the realtor family, correct?
Oh yeah, the common law employee does not have to be a realtor. In fact, most of the time what we're finding is that the real estate agency has, two people in the office. One's processing paperwork, one's answering the phones, and then we have 15 or 20 agents outside of that. That's a perfect group for us.
Yeah, okay. Well, I'm sorry to the appraiser who's commenting, where you can hear our insurance folks are going to do their best to try to bring you in, but it is finding that line. Technically, you're still an affiliate, and although you're related, it's an affiliate. And I get the concern from the insurance industry, because then you get a lot of people tagging on that truly aren't part of the association. I understand the concern. Okay. All right. So carry on.
Let's go back one slide, Sally. So administration, we've had a lot of questions about how administration is, how do we collect premiums, this, that, and the other. So what we did is we tried to find a seamless process as possible. And by that, I mean having a third-party administrator to help us collect premium, establish eligibility, remit premium to Providence, and more importantly, take COBRA out of the hands of the groups that are participating. QVI Risk Solutions is our partner. They're out of Bend, Oregon. I've had a long-standing business relationship with these folks, and they're just fantastic to work with. They're on top of things. They do a great job. Part of that process is going to be the fact that you have to sign an EFT draft and an ACH pull for QVI to draw that premium out of your bank account, whether you're on the business side or whether you're on the individual side. One of the things that we didn't want to have to do is chase checks and try to track down people and say, hey, by the way, we need to get your premiums in and stuff like that. This is going to be a monthly occurrence, usually somewhere around the 20th, I would imagine, is what we've discussed. They're going to pull those premiums, they check it against the eligibility, and then they'll send it in to Providence with the reconciliation, and also handle COBRA services. And COBRA services is kind of a cool thing. If you lose your coverage, you don't have to go to the individual market. You can stay with that plan and pay the premiums like you were before, or if you're a common law employee, you would then pay whatever the portion of your premium that you were getting covered by the provider. Adds, deletes, changes, mid-year status, all that stuff is handled by QVI. We're going to carbon copy us or whoever your agent is. And one of the things that I should state is, depending on your location, we've got a vast network of agents throughout the state that have centers of service in Medford, in Eugene, in Portland, in Central Oregon, in Hood River, in Pendleton. There's all sorts of agents throughout the state that can help you navigate this sometimes confusing, health insurance world. And we tried to contract with the, best in class. And, some of them are starting to see some success and providing some great service for our members. So anyway, that's kind of how it goes for administration. There's some paperwork that has to be done, and that's pretty self-evident once we get a case to go. Go ahead.
So Dave, some of the companies have a number of offices, Keller Williams, ReMax. Is it all under one? And they don't have to sign up individually, right? It can be under the whole corporate umbrella, or could individual branch offices sign up without other offices joining in?
Yeah, and that's kind of the beauty of it, is that we can sign up individual offices. I'm working with 3 or 4 different Keller Williams offices right now to see if there's interest in order to bring the plan to bear. There is some flexibility on how we go about writing groups. If you have an LLC within a group and they have a W-2 employee with 8 or 9 agents on it, we can write that as a group, that particular piece of the larger pie, in order to bring benefits to those individuals.
I love that. That's a great, because a lot of big companies and even small companies have teams. There are teams within companies. So you're saying a team, as long as the team leader or principal broker.
Business entity.
Okay, got it. Okay, so they could sign up even if their office didn't want to. They could sign up their team.
Correct.
Okay.
Yeah. As long as that's a separate LLC, we have to have a business entity to discuss. Sally, is there anything you wanted to add there?
No, I think you've pretty much explained it. As long as there's a common law employee and they are an entity, they can sign up. There was a really great question, and I think that it was probably the perfect question to describe how this works. Can coverage be offered through a franchised office, example ReMax, to its 1099 and its W-2 employees? And the answer is yes, that's what this is designed for. And I think that's a really important distinction. Association health plans, small employer businesses cover their employees, And Providence has always allowed a small entity to cover their 1099 workers if they'd like as well. And so that's why this works really well for the Oregon Realtors, because you have to have that common law employee to be considered a group. But then once you are considered a group, you have to have a common law employee eligible and enrolling. Then you can offer it to all of your eligible employees and your 1099 enrollees as well.
So if a company, let's say an office, a ReMax office, just using that for example's sake, if they have an office of 100 agents and they have 10 employees on staff working the front desk, helping the agents do their thing, but they're W-2 employees, they only need to have one of those W employees on the plan to qualify. They don't have to have all 10 on, and they have to have one. All 10 could be, but they only have to pay 50% of one, or do they have to pay 50% of the premium for all W-2 employees on the plan?
They have to offer it to all, so they have to offer it to all employees that meet the eligibility guidelines. So they set their hours at 35 hours and they have their probationary period, and they have 10 W-2 and the rest are 1099. They offer them all uniformly to all of them, but only one has to enroll. If everybody else waived off, that was fine. One has to enroll, and they are required to pay at least 50% of the coverage of the lowest cost plan. They can put in, a few plans, but of the lowest cost plans for that common law employee.
Gotcha. So if there's 4 W-2 employees that participate in the plan, they're paying 50% of the premium for all of them. They're employees.
Yeah, most of the time what we're seeing is that those people are already covered anyway.
Yes.
So it's an opportunity for us to get, those people on the plan, meet our common law employee criteria, and then offer it to the 10 or 12 or 15 or 20 agents that might be participating in that office.
Yeah. What if you have one W-2, it's a husband-wife office, they have one W-2 employee, but they have coverage elsewhere? Will they be eligible to participate, the husband-wife?
The state of Oregon actually requires that they have one, not just eligible, but enrolling, because, and they actually got that ruling from the Department of Justice, because that small employer would only qualify for a tax credit if they had a common law employee enrolling, because if only owners and spouses of owners were enrolling, they wouldn't be eligible for a tax credit. So the state of Oregon's deemed they therefore wouldn't be a small group.
So one of the benefits, and I'm asking Dave and Sally to explain this, with the association health plan is that while some of these companies have been able to offer insurance to their W-2 employees already under small group, they now can do it under large group, including their agents, which hasn't happened before. And the large group premiums, it's typically a significant savings for these companies, correct? I mean, it is for me. I'm doing it for Oregon Realtors and our staff, and I cannot believe how much money we're saving in 2021 under the large group plan as opposed to the small group, which we've been under in the past.
Yeah, it's true. There's a lot of flexibility in a large group contract, and that is the benefit of having an association health plan contract, is the flexibility and the design work you can do with the plan designs. You're not as prescribed to the small group like metal tier type market. Why do we have a 75% participation requirement? That is just a requirement that underwriting has put in place to prevent adverse risk and adverse selection. And the minimum hour, I had mentioned hours, whatever hours they set, each group within the Oregon Realtors, so ReMax or whatever one that's signed up, they get to set their hours worked requirement. And so they can go down, 20, 30 hours. They also get to set their probationary period, as Dave mentioned before, so they could be eligible, the first of the month following 30 days or 60 days. So each entity can pick and make some flexibility to their eligibility within their own entities.
And one of the things that we want to mention is that, we need, in order for this to have longevity in our marketplace, we have to have what's called spread of risk. And part of spread of risk is having that 75% minimum. It ends up not being 75% when you count the waivers, but at the end of the day, we want to get, you're going to have healthy people, you're going to have moderately sick people, and then you're going to have very sick people. And we want a good spread of risk on those individuals so that we can have this plan, not just for a year or two, but for 10 or 15 or 20 years down the line, so that it can really, really benefit a lot of people. I mean, it goes back to kind of the law of large numbers. We want to have as many people on the plan as possible.
Which is why if we don't do it this way, and I thank goodness for Providence and their willingness to step up and work with us on this to make it happen. But because of what you just talked about, Dave, the adverse risk pool, other carriers are like, no shot. We're not touching that pool.
Yeah.
Right. I mean, and that's why you've got to have that's why these are so difficult. You know, these kind of plans have been so difficult to bring to our independent contractor members. And I can't emphasize enough how grateful I am to both of you for all the hard work you put into this, because I'd like our members to really know there's only one other state realtor association that offers this same thing, true large group health. There's a variety of quote unquote insurance and medical offerings that associations offer, but it is not true group health. We are only one of 2 states in the country that are realtor associations that can offer this for their members. And in Alabama, they do it the same way. It has to be signed up exactly like we're doing it here. A couple other states had it and they got suspended. The programs got suspended because of the lawsuit and the issues with Obamacare and so forth. So this is, while it may be frustrating for some of you because you're sole proprietors or you're not going to meet the eligibility, this is a new launch. We're going to be able to work and tweak over the years as long as it's successful. So this is a huge, epic success for the Realtor Association, if I must say so myself. But I'm really excited about this, and I'm hoping we can, as the years go on, we'll figure out ways to expand the program,
Right. Exactly.
and make it work for everyone. But got to play by the rules to start.
Sorry, Jenny.
No,
we've got about 15 minutes left, and I've seen quite a few questions about the plans and plan designs and stuff like that. I really want to give Sally the rest of the time to go through the plan designs, give some background on Providence. They're a great carrier. You know, Sally and I have been joined at the hip for the last 2 years. It seems like we've, had our kids go through all sorts of stuff during that period of time. But I really do want to turn it over to Sally at this time and let her go through all the benefits and, the fantastic people that we have at Providence. I can't say enough about them.
Thank you, Dave. I'm going to scroll through a couple of the slides quickly because I had some information on who Providence is, but since this is the Oregon Realtors, Providence is a very large carrier in the state of Oregon, so you've probably heard of us. I have been kind of scrolling through the questions, so I want to address a couple of things. This is a statewide health plan, and we have statewide network. So whether you're in Brookings or in the Eastern Oregon or in Portland, but you live in Vancouver, we have a plan. As long as you're part of a realtor group that's domiciled in Oregon, you can work or reside. So if you are in Washington, but you're part of an Oregon realtor group, you can be on our plan, and we have network throughout the United States. So I'm gonna go over the network discussions in just a minute, but we are throughout the whole state of Oregon, and we have a very robust, over 1 million providers in our network. I'm going to skip over the 2 slides that I had that just kind of talked about Providence, but we do have a lot of accreditations. We're a 4.5 star. We're a carrier from CMS for Medicare. We're in the top 15% nationwide from Medicare ratings, and we're an NCQA accredited plan with 4 out of 5 of our rankings. We're the top rated PPO in the state of Oregon, and we're in the top, I think 4% nationwide. For PPO plans. And so these are some of the clients we serve. Other associations that we serve are State-Owned Contractors Exchange, Multnomah Bar we've had for over 25 years. We have the Oregon Association of Nurseries. This is our newest association, but we also are putting up 2 new associations, not standing up with 0 membership, but our newer ones for January are the CPAs. And a new emerging association that will be writing soon is wine growers, because Oregon is wine country.
Is the criteria the same?
Yes,
sorry,
they're all very similar. They all have to be an association group plan. They have to qualify as a group on their own right, as a business that is a group with at least a common law employee. So they all have very similar criteria that was submitted to the state that had to be approved. Most of them were on hold with the Oregon Realtors Association because they were filed a year ago. They were one of the 14. But the ones that we've had in place, it wasn't just that they were assessing, are the new ones something that we want to approve? They also did a data call on a lot of the existing association plans in state and the Oregon, just to make sure that they're all within compliance and meeting some of the new regulations for association plans.
So if
Going
you
into
could
the-
see the questions, I think, I'm sorry, I don't mean to
No, it's
interrupt you, but
okay.
I just want to make sure that this is cleared up with the members. I think that's where a lot of the confusion lies because it's called an association health plan. They are members of our association. So the
Mhm.
misunderstanding is, well, then I'm a sole proprietor, I'm an individual contractor, it's an association health plan, why can't I enroll? And that's
Mhm.
where I just want to make sure, although this is, you had to apply as an association health plan through the Oregon Realtors, the type of plans and the criteria are not as simple as it's an association health plan.
Right, and
About
then
the question.
maybe another good example would be like the CPAs or Multnomah Bar Association or nurseries, or Oregon Association of Nurseries. If the nursery went to apply for the Oregon Association of Nurseries that Providence insures, if they only had mom, pop, husband, wife, and they were just all owners and they didn't have any other employees, they wouldn't qualify for the Oregon Association of Nurseries health plan that we've had in place for several years.
Got
So
it.
it's a very similar
And-
criteria.
And one thing, if you look at the Multnomah Bar, about 10 years ago, they had to eliminate all coverage for sole proprietors. And Sally, correct me if I'm wrong, but that was right at the time of Obamacare because the rules changed.
Yeah, there's been some pretty strict rules put in place on the association health plans in recent years. And one of them is to make sure that they are all functioning as group contracts.
So it is a way, the term association health plan is just a way to bring all of our brokerages together to qualify for large group. It's not individual coverage. It's the way for these companies to come together under the association health plan and take advantage of large group health as opposed to individual coverage.
Correct.
And if that's
Okay,
still
so-
confusing for people, Dave is more than happy to answer any questions you have, and we will make sure you have his phone number.
Excellent. And I do want to put a plug in for your website. So the Oregon Realtors website does have a lot of information, and we are loading more and more information as we can for information on how the plans work. But there are lots of plans available. Our richest plans are the premium plans. We have 4 premium plans that are being offered to the Oregon Realtors, and they have deductibles as low as $250 for those premium plans. They have deductibles waived for the PCPs, the specialists, the emergency room, urgent care, imaging, so for PET scans, CT scans. Those are the 4 premium, they used to be called Cadillac style plans. And there's 4 of those being offered to the Oregon Realtors. We have 6 plus plans, which are they're just very comprehensive plans as well. They don't have the deductible waive for the emergency room, but we do have the deductibles ranging from $1,500 to $6,000 with very affordable premiums. The deductible on the plus plans is waived for PCP, specialists, urgent care, and for diagnostic lab and x-ray. The first 500 is covered in full to network providers, but the deductible is applied for the emergency room and imaging. So that's how they're a little less rich than the premium plans. We have 4 HSA embedded plans, so HSA qualified plans. If you wanted to put in an HSA, those are at a very affordable premium. The Premium Plus and HSA plans all feature common deductibles. That's a very rich feature. I don't think we have any small group plans on the market that I've seen that have common deductibles. And so that means if whether you're seeing an in-network provider or an out-of-network provider, you have 1 deductible and 1 out-of-pocket maximum. So you don't have a separate one on the Premium Plus and HSA plans. We also have Connect and Choice that we're being offered, and I'm going to go over what that means in a minute from a network standpoint. But a Connect or a Choice plan is a patient-centered medical home. So similar to the old HMO days where you had to pick a PCP, a Connect and Choice is picking a clinic. And we have lots of clinics. Every family member can have their own clinic. So you could have a clinic, your spouse could go to a different clinic, and then your child could go to a pediatric clinic that's a certified patient-centered medical home. We have 16 total plans at a very affordable premium for Connect and Choice. And then all the plans that we're offering include coverage for prescription drugs, full service vision, including hardware like glasses or contact lenses, and chiropractic manipulation and acupuncture. That's all embedded in all of these plans, and they include coverage for eligible family members and dependents, as well as domestic partners. The network options that are available, the Providence Signature Network is what's on the Plus, the Premium, the HSA plans. It's over 1 million providers. In Oregon and Southwest Washington, we use our own proprietary network that we contract. In the rest of the United States, we use First Choice or First Health. So you have access to over 1 million providers throughout the United States. You actually have worldwide coverage with Providence. So if you're traveling and something happens, You have worldwide coverage with Providence. Providence Connect and Choice, as I mentioned previously, are the patient-centered medical home plans. They're offered at an extremely affordable premium. What we see employers most often doing is putting in 2 or 3 plans, depending on how many employees you have enrolled, and that 50% contribution toward your one common law employee is often based upon the base or the lowest cost plan. So if you put in like a Connect or a Choice, a patient-centered medical home plan at a very affordable premium, and you have to pay at least 50% of contribution toward those common law employees, but those inexpensive plans could be your base plan, and then you could have a buy-up plan to the full signature network of Premium Plus or an HSA option. So Providence Connect is in the Portland market. It has over 80 patient-centered medical homes. And then Providence Choice is statewide. We have over 410 medical homes on Providence Choice throughout the state of Oregon. We're adding them every day, but it's a very comprehensive network of providers through Providence Choice Network. So that's a really quick overview of the plans. We do have a toolkit or a plan overview that kind of has all the plans laid out in this nice little PDF that we've shared with the Oregon Realtors. We just made a quick update to it this week to put the new really pretty logo on there for Oregon Realtors, and we'll send that over so that can be uploaded to the site as well. And it'll have a little more information on how these plans work.
Hey, Jenny, I do want to reiterate something, because I've seen half a dozen or a dozen questions come through over the course of the last couple of minutes. We've had a lot of questions regarding, well, how do I get the rates? It's kind of a chicken and the egg situation, in that we have to have data in order to provide you with a quote. And the data is name, date of birth, gender, and zip code for all those individuals that are participating in the plan. That gives us what's called our census. Our census is derived by those factors. Once we get that census, we plug it into the quoter, send it over to Providence for a review. They send it back to us, and then we can deliver some rates. So the rates are really based, if you have a really old group, let's say your average age is 70, for example, your rates are going to be very, very high. If you have a group that is under 40 and average age of 37, you're going to have fantastic rates. What we're finding is that we have someplace in the middle. So you're going to have an average age of about 47, and the rates are going to be based on the census that we get. And then once we get that, then we determine effective dates. We get enrollment materials. We turn that enrollment materials into Providence. They certify the rates, and then we move forward. So
Dave, I wanted you to clarify, because you said one thing that I think might be confusing on the census. You said
Yes.
all those participating in the plan need to fill it out. It's not that, that's sort of confusing. Let's say you go to a ReMax office, you need all of their agents to fill it out, even if they're ultimately not going to sign up for the plan, because you can't develop a good consensus of 20 agents out of 100 that won't fill out the census. So you guys really did that. Is that a fair explanation?
Yeah,
Clarification.
Very good. If we go into an office that has 50 people and we get 10 responses, that tells me that it's probably not a good group for us to move forward with. If we get all the responses and we see, well, we've got 25 people that are waiving coverage and these are the 25 that are interested, that's something that I can work with.
Okay, so it's really, really important for your companies or the principal brokers, whoever's running the show there, to get all of your agents to fill out the census. It takes 3 minutes. It doesn't obligate them to participate in the plan, but Dave and his team cannot get a rate for your office if you don't get everyone to fill it out, or at least 80%, 70 to 80% of the folks in the office. Is that?
Yeah, and for that matter, we need dependent information as well. So
Okay.
once we get that information, we develop a set of rates. And at the end of the day, if that census varies from enrollment, final rates will be determined by final enrollment, right? So if we have all the older people fall off the plan and have valid waivers, we're going to have a better rate. If all the older people stay on the plan, then you're going to have an increase in rates, and then have to have a discussion about that. But
So you go
rates
in.
are determined by final enrollment.
you go in, you get the census, you take it back to Providence, you get your rates, then you take the rates, you go back to the company and say, of all the people that filled out the census, this is what your rate looks like. Then the principal broker or the manager will say, okay, look, this is how it's going to look, everyone. And their agents will say, okay, I'm on. Or some of them may say, nope, I'm waiving out or I'm not in. Then you're going to take that final number back to get a final rate to present to the company or
Correct.
the office.
Correct.
Okay.
Yeah, and
Yeah, and
there is a question, is this available right now? And I do think that's important to note that this plan is already live. So it is something that
We actually have
available now.
had some groups that have been interested in being, for lack of a better description, our guinea pigs to make sure that this process works. And they've been fantastic to work with. So we've had, Jenny being one of them, but we also have some groups coming on for January 1st that were kind of early adopters that we, told them that, we're going to have some bugs in this thing. And so far it's ran very, very smoothly. You would think after, over 100 meetings that we would have this dialed in, and I think we do.
Good. Yes, well, I'm really excited, and I hope our companies that have signed up with you will be very pleased, and we'll look forward to getting feedback once it launches, once they're all on board and going and receiving coverage. And I know that we at Oregon Realtors have been very pleased with Providence and the service and the healthcare we get. So I hope our members are as well. And it is a work in progress. So Dave and Sally and their respective teams will take feedback and continue to refine the plans over the years, but we just need to get going and very excited. So Dave, how can our listeners here contact you if they have additional questions, which they will?
My information is on the website. Also,
Okay.
all of our agents' information is on the website. So if you're in Medford or if you're in Eugene, or if you're in various locations throughout the state, there are sources of service within the website. You can click on it and call and ask them for information.
Okay. All right. A lot of additional questions we didn't get to, but we will print them out. We'll check out our website and see if they're already on the FAQs. If not, Dave and Sally will work with perhaps adding to our FAQs. Sole proprietors do not qualify under this large group health plan.
Jenny, we've got a bunch of people asking what website, and that is the Oregon Realtors website that has all the information, all the consultants, all the guidelines, all the plan information. You can download the toolkit and take a look at it. So
there's a link embedded in the chat, and it's OregonRealtors.org. And I should know exactly where on the website it is, but it's there. And if you can't find it, please
it's in member benefits. It's in member benefits, and then you click on those. I think it's the top tab that says health insurance. There's also a dental plan in there as well that has open enrollment right now.
Okay. If you need any help, feel free to call our office at OAR 800-252-9115 or Dave for specifics on the plan, because I'm just going to send you to him anyway. So thank you, Dave and Sally. I know there's a lot of little intricacies, and I'm sorry we couldn't get to everyone's questions. I do hope that this hour provides some clarification. And happy holidays, everyone. And here's to
happy holidays. And thank you for attending. Thanks, Jenny and the OAR team.